Hello everyone, I'm Dr. Chen. Today we will go over how to position and scan lumbar puncture. When performing a lumbar puncture on patients who are obese or muscular, it can be quite difficult to touch the anatomical landmarks, which often leads to failed punctures. In such cases, ultrasound can be used to help us locate a puncture site. Ideally, we first touch the upper edge of the patient's iliac bone and align it with the lumbar spine level. At this point, it's better to use a curved probe. Set the depth to around 5 to 10 centimeters depending on patient's body size. With transverse scanning, we can quickly identify spinous process. With some slight angle adjustments up and down, we may even see the spinal canal and vertebral body beneath. This position can help us determine the midline. We might even find a potential interspinous gap nearby for marking the puncture site. Moving similarly from top to bottom can also help confirm the midline. To determine the appropriate spinal level, let's turn to sagittal. Now let's slide the probe laterally from the midline to locate the lamina. Then we continue moving the probe downward until we reach the sacrum. The sacrum is a relatively flat bone, so we can clearly see the sacral bone at this point. Moving back upward, the first junction we see is the L5-S1 interspace. Then above it are the L4-L5 and the L3-L4 interspaces. By using this method together with midline localization, we can clearly determine which level is ideal for the puncture. If localization is still difficult, we can consider using the paramedian approach. In a real-time setting, we can place a sterile cover on the probe and perform the puncture procedure in a fully sterile environment. This can also be used to carry out the lumbar puncture procedure. This is a deeper and more technically challenging technique, so it is often recommended for those with more experience or practice to operate. I hope this is helpful to your practice. That's all for today's tutorial. I will see you in the upcoming videos.